1. Which of the following is a core symptom of major depressive disorder, MDD? A. Increased energy. B. Excessive happiness. C. Decreased interest in activities. D. Hypomania. Answer: C. Decreased interest in activities. Rationale: decreased interest or pleasure in activities, also known as anhedonia, is a hallmark symptom of MDD. The other options do not reflect typical symptoms of MDD. Increased energy is often associated with mania, not depression. 2. Which neurotransmitter is most commonly implicated in the pathophysiology of depression? A. Acetylcholine. B. Dopamine. C. Serotonin. D. Gamma-aminobutyric acid, GABA. Answer: C. Serotonin. Rationale: serotonin is one of the key neurotransmitters involved in depression. A deficiency in serotonin is often associated with depressive symptoms. Dopamine is also involved but is more directly related to pleasure and reward pathways. Acetylcholine and GABA play roles in other functions but are not primary in depression. 3. A patient presents with persistent sadness, changes in appetite, sleep disturbances, and difficulty concentrating for 2 weeks. Which condition should be considered? A. Generalized anxiety disorder. B. Major depressive disorder. C. Bipolar disorder. D. Schizophrenia. Answer: B. Major depressive disorder. Rationale: major depressive disorder, MDD, is diagnosed when a person experiences a depressed mood or loss of interest in daily activities, accompanied by physical symptoms such as sleep changes, appetite disturbance, and cognitive issues for at least 2 weeks. Bipolar disorder includes periods of mania, and generalized anxiety disorder primarily involves excessive worry, not mood disturbances. 4. Which class of medications is commonly used as first-line treatment for major depressive disorder? A. Antipsychotics. B. Antidepressants. C. Benzodiazepines. D. Stimulants. Answer: B. Antidepressants. Rationale: antidepressants, particularly selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, are the first-line treatment for major depressive disorder. Antipsychotics are used in severe cases or in the context of psychosis, and benzodiazepines are used for anxiety, not depression. Stimulants may be used for certain conditions like ADHD, but not depression. 5. Which of the following is a common side effect of selective serotonin reuptake inhibitors, SSRIs? A. Weight loss. B. Sexual dysfunction. C. Increased appetite. D. Dry mouth. Answer: B. Sexual dysfunction. Rationale: sexual dysfunction, including decreased libido and difficulty achieving orgasm, is a well-documented side effect of SSRIs. Weight loss is not commonly associated with SSRIs, and increased appetite or dry mouth is not a typical side effect either. SSRIs are more likely to cause weight gain or sexual dysfunction. 6. Which of the following is a common symptom of depression in children and adolescents? A. Irritability. B. Hyperactivity. C. Increased appetite. D. Elation. Answer: A. Irritability. Rationale: in children and adolescents, depression is often characterized by irritability or anger rather than sadness. Hyperactivity, increased appetite, and elation are not typical of depression in younger populations. 7. Which of the following is an example of a non-pharmacological treatment for depression? A. Electroconvulsive therapy, ECT. B. Cognitive behavioral therapy, CBT. C. Antidepressants. D. Antipsychotics. Answer: B. Cognitive behavioral therapy, CBT. Rationale: cognitive behavioral therapy, CBT, is a well-established non-pharmacological treatment for depression. ECT is a medical procedure, antidepressants are pharmacological treatments, and antipsychotics are used for psychosis, not depression. 8. A patient with depression is complaining of constant fatigue, even after sleep. This symptom is known as A. Anhedonia. B. Hypersomnia. C. Psychomotor agitation. D. Avolition. Answer: B. Hypersomnia. Rationale: hypersomnia refers to excessive sleepiness or prolonged sleep, which is a common symptom of depression. Anhedonia is the inability to experience pleasure. Psychomotor agitation refers to physical restlessness, and avolition refers to a lack of motivation. 9. Which of the following medications is classified as a serotonin-norepinephrine reuptake inhibitor, SNRI? A. Fluoxetine. B. Duloxetine. C. Amitriptyline. D. Paroxetine. Answer: B. Duloxetine. Rationale: duloxetine is a serotonin-norepinephrine reuptake inhibitor, SNRI, which works by increasing serotonin and norepinephrine levels in the brain. Fluoxetine and paroxetine are selective serotonin reuptake inhibitors, SSRIs, and amitriptyline is a tricyclic antidepressant. 10. The most serious side effect of tricyclic antidepressants, TCAs, is A. Weight gain. B. Cardiotoxicity. C. Sexual dysfunction. D. Insomnia. Answer: B. Cardiotoxicity. Rationale: tricyclic antidepressants, TCAs, have the potential for cardiotoxicity, particularly arrhythmias, due to their anticholinergic effects. Weight gain and sexual dysfunction are more common with other antidepressants, and insomnia is typically treated rather than caused by TCAs. 11. In a person with depression, which of the following behaviors may increase the risk of suicide? A. Social withdrawal. B. Increased sleep. C. Excessive energy. D. Decreased appetite. Answer: A. Social withdrawal. Rationale: social withdrawal is a key warning sign for suicide risk in individuals with depression. Increased energy or decreased appetite may occur, but social withdrawal and isolation can indicate a person is withdrawing from support networks. 12. Which of the following is a characteristic of dysthymia, persistent depressive disorder? A. Severe mood swings. B. At least 2 years of chronic low mood. C. Frequent manic episodes. D. Impaired reality testing. Answer: B. At least 2 years of chronic low mood. Rationale: dysthymia, now called persistent depressive disorder, is characterized by a chronic low mood lasting at least 2 years. Severe mood swings are more typical of bipolar disorder, and mania and impaired reality testing are not present in dysthymia. 13. Which brain structure is thought to be involved in the regulation of mood and implicated in depression? A. Hippocampus. B. Cerebellum. C. Medulla oblongata. D. Thalamus. Answer: A. Hippocampus. Rationale: the hippocampus is involved in the regulation of mood and is thought to be smaller in individuals with depression. The cerebellum primarily governs motor control, and the medulla and thalamus are involved in other bodily functions unrelated to mood regulation. 14. Which of the following is an appropriate nursing intervention for a patient who is at risk for suicide due to depression? A. Allow the patient to express feelings freely. B. Encourage the patient to make decisions independently. C. Maintain a safe environment with no harmful objects. D. Reassure the patient that their depression will quickly resolve. Answer: C. Maintain a safe environment with no harmful objects. Rationale: ensuring patient safety by removing harmful objects is crucial in preventing self-harm. While expressing feelings is important, encouragement of independence or false reassurances can be harmful. 15. Which of the following would be considered a somatic symptom of depression? A. Weight loss. B. Hallucinations. C. Delusions. D. Euphoria. Answer: A. Weight loss. Rationale: somatic symptoms of depression are physical symptoms that accompany mood disturbances, such as weight loss, sleep disturbances, and fatigue. Hallucinations, delusions, and euphoria are not typical of depression, but rather of psychosis or mania. 16. What is the primary mechanism of action of selective serotonin reuptake inhibitors, SSRIs? A. Inhibit dopamine reuptake. B. Block serotonin receptors. C. Increase serotonin availability by inhibiting reuptake. D. Increase norepinephrine synthesis. Answer: C. Increase serotonin availability by inhibiting reuptake. Rationale: SSRIs work by inhibiting the reuptake of serotonin, making it more available in the synaptic cleft. They do not directly block serotonin receptors or affect dopamine or norepinephrine synthesis. 17. Which of the following therapies is commonly used to treat patients with treatment-resistant depression? A. Electroconvulsive therapy, ECT. B. Cognitive behavioral therapy, CBT. C. Antidepressant medications. D. Aromatherapy. Answer: A. Electroconvulsive therapy, ECT. Rationale: electroconvulsive therapy, ECT, is often used for patients with severe or treatment-resistant depression when other therapies have failed. CBT and antidepressants are more common first-line treatments, while aromatherapy has not been shown to be effective in severe cases. 18. A patient taking an SSRI reports experiencing difficulty sleeping. Which of the following should the nurse recommend? A. Take the SSRI at bedtime. B. Take the SSRI on an empty stomach. C. Increase daytime napping. D. Take the SSRI in the morning. Answer: D. Take the SSRI in the morning. Rationale: SSRIs can cause insomnia as a side effect. Taking them in the morning may reduce this symptom and prevent interfering with nighttime sleep. Taking them at bedtime, increasing napping, or taking them on an empty stomach may exacerbate insomnia or cause other issues. 19. Which of the following is a common comorbidity associated with depression? A. Hyperthyroidism. B. Diabetes mellitus. C. Parkinson's disease. D. Schizophrenia. Answer: B. Diabetes mellitus. Rationale: depression is commonly comorbid with chronic conditions like diabetes mellitus, which can exacerbate the symptoms of both conditions. Hyperthyroidism and Parkinson's disease may share some symptoms with depression, but they are not as commonly comorbid. Schizophrenia is a different psychiatric disorder. 20. Which of the following is considered a first-line pharmacological treatment for generalized anxiety disorder, GAD, and depression? A. Benzodiazepines. B. Selective serotonin reuptake inhibitors, SSRIs. C. Antipsychotics. D. Stimulants. Answer: B. Selective serotonin reuptake inhibitors, SSRIs. Rationale: SSRIs are commonly prescribed as first-line treatments for both generalized anxiety disorder, GAD, and depression. Benzodiazepines are typically used for short-term anxiety relief, antipsychotics are used for psychotic disorders, and stimulants are used for ADHD, not depression. 21. Which symptom of depression is often considered the most challenging to treat? A. Weight gain. B. Insomnia. C. Cognitive impairment. D. Anhedonia. Answer: D. Anhedonia. Rationale: anhedonia, the inability to experience pleasure, is often one of the most challenging symptoms to treat in depression, as it impacts the patient's overall quality of life. Insomnia and cognitive impairment can also be difficult, but are usually more responsive to treatment. 22. Which of the following is a risk factor for developing depression? A. Excessive physical activity. B. Having a supportive family network. C. A history of trauma or abuse. D. Regular participation in social activities. Answer: C. A history of trauma or abuse. Rationale: a history of trauma or abuse is a significant risk factor for developing depression, as it can have long-term effects on mental health. Having a supportive family network, engaging in social activities, and physical activity are protective factors against depression. 23. What is the primary goal of cognitive behavioral therapy, CBT, for depression? A. To reduce stress through physical relaxation techniques. B. To change negative thought patterns that contribute to depression. C. To address past trauma and emotional issues. D. To encourage medication adherence. Answer: B. To change negative thought patterns that contribute to depression. Rationale: CBT focuses on identifying and changing negative thought patterns that can perpetuate depression. While it may involve stress reduction and some past trauma work, its primary goal is to modify dysfunctional thoughts and behaviors. 24. Which of the following is the most common complication of untreated depression? A. Improved sleep. B. Chronic physical illness. C. Psychosis. D. Suicidal ideation. Answer: D. Suicidal ideation. Rationale: one of the most serious complications of untreated depression is suicidal ideation, which can lead to suicide attempts. While untreated depression can contribute to chronic physical illness, psychosis is a less common complication. 25. A patient with depression and a history of bipolar disorder should avoid which class of antidepressants? A. SSRIs. B. Tricyclic antidepressants, TCAs. C. Monoamine oxidase inhibitors, MALIs. D. SNRIs. Answer: C. Monoamine oxidase inhibitors, MALIs. Rationale: patients with bipolar disorder are at increased risk of mania when treated with monoamine oxidase inhibitors, MALIs, which can induce manic episodes in these individuals. SSRIs, TCAs, and SNRIs are typically considered safer in this population, although close monitoring is still required. 26. Which of the following is a potential side effect of long-term antidepressant use? A. Hair loss. B. Sexual dysfunction. C. Increased appetite. D. Dehydration. Answer: B. Sexual dysfunction. Rationale: sexual dysfunction is a well-known side effect of many antidepressants, especially SSRIs. Hair loss, increased appetite, and dehydration are not common long-term side effects of antidepressants. 27. Which of the following is the most important factor in assessing suicide risk in a patient with depression? A. The presence of a support system. B. History of previous suicide attempts. C. Social isolation. D. Severity of depressive symptoms. Answer: B. History of previous suicide attempts. Rationale: a history of previous suicide attempts is one of the strongest indicators of future suicide risk. While social isolation, the severity of depressive symptoms, and the presence of a support system are important, previous attempts are the most predictive factor. 28. Which of the following is the most likely outcome for patients who receive appropriate treatment for depression? A. They will experience no further episodes of depression. B. They will experience significant improvements in mood and functioning. C. They will be permanently medicated for the rest of their lives. D. They will develop a different mental health disorder. Answer: B. They will experience significant improvements in mood and functioning. Rationale: with appropriate treatment, patients with depression typically experience significant improvements in mood and functional ability. However, not all patients will be free from future episodes, and treatment may not always be lifelong. 29. Which of the following is an appropriate nursing intervention when discussing medications with a patient newly diagnosed with depression? A. Provide a detailed list of potential side effects. B. Reassure the patient that side effects are rare. C. Discuss the importance of medication adherence. D. Avoid discussing side effects to prevent anxiety. Answer: C. Discuss the importance of medication adherence. Rationale: it is crucial to emphasize the importance of medication adherence to ensure treatment efficacy. While side effects should be discussed, it is also important to provide information in a balanced way and avoid causing unnecessary anxiety. 30. Which of the following therapies has been shown to have the best evidence for treating depression in patients with concurrent anxiety? A. Electroconvulsive therapy, ECT. B. Cognitive behavioral therapy, CBT. C. Supportive psychotherapy. D. Mindfulness-based stress reduction, MBSR. Answer: B. Cognitive behavioral therapy, CBT. Rationale: cognitive behavioral therapy, CBT, has the strongest evidence base for treating both depression and anxiety. ECT is typically reserved for severe cases, and supportive psychotherapy and mindfulness-based stress reduction have benefits, but less robust evidence for treating both conditions simultaneously. 31. Which of the following is a key diagnostic feature of major depressive disorder? A. Delusions and hallucinations. B. Chronic feelings of sadness for at least 2 weeks. C. Rapid speech and impulsivity. D. Episodes of elevated mood lasting more than 1 week. Answer: B. Chronic feelings of sadness for at least 2 weeks. Rationale: major depressive disorder is characterized by a persistently low mood lasting for at least 2 weeks, along with other symptoms such as sleep disturbances and appetite changes. Delusions and hallucinations are not common in MDD, and elevated mood or impulsivity suggest other conditions. 32. A common side effect of SSRIs that patients may experience during the initial stages of treatment is A. Increased appetite. B. Sexual dysfunction. C. Euphoria. D. Increased energy. Answer: B. Sexual dysfunction. Rationale: sexual dysfunction, including reduced libido and difficulty achieving orgasm, is a well-documented side effect of SSRIs. Increased appetite or euphoria is not commonly associated with SSRIs, and increased energy can occur in the context of other disorders like mania. 33. Which of the following is an indicator that depression may be improving in a patient? A. Decreased appetite. B. Increased interest in activities. C. Sudden weight loss. D. Excessive sleeping. Answer: B. Increased interest in activities. Rationale: increased interest in activities is an indicator that the patient is improving, as it signals a return of pleasure or engagement in life. Decreased appetite, weight loss, and excessive sleep are signs of ongoing depression or an inadequate response to treatment. 34. The primary mechanism of action of monoamine oxidase inhibitors, MAOIs, is A. Blocking serotonin receptors. B. Inhibiting the reuptake of serotonin. C. Increasing norepinephrine and serotonin by inhibiting their breakdown. D. Enhancing dopamine synthesis. Answer: C. Increasing norepinephrine and serotonin by inhibiting their breakdown. Rationale: MAOIs work by inhibiting the monoamine oxidase enzyme, which breaks down neurotransmitters like serotonin, norepinephrine, and dopamine. This leads to increased levels of these neurotransmitters in the brain. 35. Which of the following is the most appropriate nursing intervention for a patient with severe depression and poor appetite? A. Provide soft, bland foods. B. Offer large portions of their favorite foods. C. Encourage the patient to fast for a few days. D. Limit fluid intake to prevent fullness. Answer: A. Provide soft, bland foods. Rationale: offering soft, bland foods can be more appealing to a patient with poor appetite and may encourage eating. Encouraging large portions or fasting is not advisable, as it may worsen malnutrition or dehydration. Limiting fluids is not appropriate in this context. 36. A major concern when prescribing tricyclic antidepressants, TCAs, is their potential to A. Cause weight loss. B. Cause anticholinergic side effects like dry mouth and constipation. C. Cause mania in bipolar disorder. D. Cause sedation and dizziness. Answer: B. Cause anticholinergic side effects like dry mouth and constipation. Rationale: TCAs can cause anticholinergic side effects such as dry mouth, constipation, blurred vision, and urinary retention. While sedation and dizziness can occur, the anticholinergic effects are more significant. Mania risk is higher in bipolar disorder and is why mood stabilizers are typically used alongside antidepressants. 37. A patient with depression is being started on an SSRI. Which side effect should the nurse educate the patient about? A. Sedation. B. Weight gain. C. Insomnia. D. Severe constipation. Answer: C's insomnia. Rationale: insomnia is a common side effect of SSRIs, especially during the initial stages of treatment. While sedation, weight gain, and severe constipation are possible, they are less commonly associated with SSRIs. 38. Which of the following conditions is most commonly comorbid with depression? A. Asthma. B. Alcohol use disorder. C. Rheumatoid arthritis. D. Hypertension. Answer: B. Alcohol use disorder. Rationale: alcohol use disorder is commonly comorbid with depression. Many individuals with depression may use alcohol to cope with their mood, although this can exacerbate depression. Asthma, rheumatoid arthritis, and hypertension can be associated with depression, but alcohol use disorder is more directly linked. 39. A patient with depression is at high risk for suicide. Which of the following actions should be taken first? A. Encourage the patient to talk about their feelings. B. Remove any dangerous objects from the patient's environment. C. Offer the patient reassurance that they will feel better soon. D. Prescribe a higher dose of antidepressant medication. Answer: B. Remove any dangerous objects from the patient's environment. Rationale: the first priority is ensuring patient safety by removing dangerous objects that could be used for self-harm. Encouraging discussion and medication adjustment are important, but safety comes first. Reassurance should not minimize the severity of the patient's situation. 40. Which of the following is a common symptom of depression in older adults? A. Delusions. B. Physical aches and pains. C. Euphoria. D. Increased energy. Answer: B. Physical aches and pains. Rationale: older adults with depression often present with physical symptoms such as unexplained aches and pains, rather than typical mood-related symptoms. Delusions, euphoria, and increased energy are not typical of depression in this population. 41. A common non-pharmacological therapy for treating depression in individuals with chronic illness is A. Electroconvulsive therapy, ECT. B. Cognitive behavioral therapy, CBT. C. Stimulant medication. D. Aromatherapy. Answer: B. Cognitive behavioral therapy, CBT. Rationale: CBT is a highly effective treatment for depression, especially in individuals with chronic illness, as it helps patients manage both emotional and physical stress. ECT is typically reserved for treatment-resistant depression, and stimulants and aromatherapy are less commonly used. 42. Which of the following is a potential complication of untreated depression in the elderly? A. Increased sleep. B. Chronic pain. C. Cognitive decline or dementia. D. Hypomania. Answer: C. Cognitive decline or dementia. Rationale: untreated depression in older adults can lead to cognitive decline or exacerbate existing dementia. Chronic pain may co-occur but is not typically the direct result of untreated depression. Increased sleep or hypomania are not common complications of untreated depression. 43. What is the primary goal of antidepressant therapy in the treatment of depression? A. To eliminate the symptoms of depression permanently. B. To stabilize mood and improve functioning. C. To reduce anxiety. D. To treat underlying medical conditions. Answer: B. To stabilize mood and improve functioning. Rationale: the goal of antidepressant therapy is to stabilize mood and improve overall functioning, rather than to eliminate symptoms permanently. While it may help reduce anxiety in some individuals, the primary goal is to address depressive symptoms and restore normal functioning. 44. A patient on an SSRI reports feeling restless and having muscle rigidity. What should the nurse suspect? A. Serotonin syndrome. B. Anticholinergic toxicity. C. Hypothyroidism. D. Neuroleptic malignant syndrome. Answer: A. Serotonin syndrome. Rationale: serotonin syndrome is a potentially life-threatening condition caused by excessive serotonin in the brain. Symptoms include restlessness, muscle rigidity, and autonomic dysfunction. Neuroleptic malignant syndrome is similar but related to antipsychotic medications, not SSRIs. 45. Which of the following interventions should be prioritized in managing a patient with severe depression who is not responding to antidepressants? A. Adjusting the dose of the current antidepressant. B. Introducing electroconvulsive therapy, ECT. C. Adding a stimulant to the regimen. D. Discontinuing antidepressants and trying antipsychotics. Answer: B. Introducing electroconvulsive therapy, ECT. Rationale: electroconvulsive therapy, ECT, is often recommended for patients with severe, treatment-resistant depression. Adjusting medication or adding stimulants may help, but ECT is more effective in cases where other treatments have failed. 46. Which of the following is a risk factor for developing depression in pregnant women? A. History of prior pregnancies. B. Lack of social support. C. Regular physical activity. D. Adequate sleep. Answer: B. Lack of social support. Rationale: lack of social support is a major risk factor for depression in pregnant women. A history of prior pregnancies, regular physical activity, and adequate sleep are protective factors against depression during pregnancy. 47. Which of the following is a characteristic symptom of bipolar disorder which may be confused with depression? A. Hypomania. B. Extreme fatigue. C. Apathy. D. Agitation. Answer: A. Hypomania. Rationale: hypomania, a period of elevated mood and energy, is a hallmark symptom of bipolar disorder. This can be confused with depression due to overlapping symptoms such as fatigue or agitation. Apathy is more typical of depression, not bipolar disorder. 48. A patient with depression is experiencing significant weight loss. Which approach is most appropriate to improve nutrition? A. Encourage small, frequent meals. B. Recommend high-calorie junk food. C. Suggest a fasting regimen. D. Instruct the patient to take appetite suppressants. Answer. A. Encourage small, frequent meals. Rationale. Small, frequent meals are an effective way to improve nutrition in patients with depression who may have a poor appetite. Junk food, fasting, and appetite suppressants are not recommended as they may worsen the patient's overall health and mood. 49. Which of the following is a potential risk associated with the long-term use of lithium in patients with bipolar disorder? A. Hyperthyroidism. B. Kidney damage. C. Dehydration. D. Weight loss. Answer. B. Kidney damage. Rationale. Long-term use of lithium can lead to kidney damage, a known side effect. Hyperthyroidism is not associated with lithium, and dehydration and weight loss are more common in acute phases, not as a long-term risk. 50. Which of the following is a primary symptom of melancholic depression? A. Euphoria. B. Emotional numbness. C. Severe anhedonia and weight loss. D. Increased energy and agitation. Answer. C. Severe anhedonia and weight loss. Rationale. Melancholic depression is characterized by severe anhedonia, loss of pleasure, and significant weight loss. Euphoria and increased energy are more typical of bipolar disorder, while emotional numbness is not a defining feature of melancholic depression. 51. Which of the following is an appropriate first-line treatment for major depressive disorder, MDD? A. Electroconvulsive therapy, ECT. B. Antidepressant medications, SSRIs. C. Antipsychotic medications. D. Cognitive behavioral therapy, CBT, alone. Answer. B. Antidepressant medications, SSRIs. Rationale. SSRIs are typically first-line pharmacological treatment for major depressive disorder. While CBT is highly effective, medications are often started first, especially for moderate to severe cases. ECT is reserved for treatment-resistant depression, and antipsychotics are not the first choice for MDD. 52. A patient recently started on an SSRI for depression reports feeling unusually anxious and jittery. What should the nurse do first? A. Stop the SSRI immediately. B. Reassure the patient that these symptoms will resolve over time. C. Assess for the presence of serotonin syndrome. D. Increase the dose of the SSRI. Answer. C. Assess for the presence of serotonin syndrome. Rationale. The nurse should assess for serotonin syndrome, a potentially life-threatening condition that can occur when serotonin levels become too high. While side effects like anxiety may occur, serotonin syndrome involves other symptoms such as fever, confusion, and muscle rigidity. The SSRI should not be stopped or dosed higher without further evaluation. 53. Which of the following is a common sign of depression in children and adolescents? A. Excessive eating. B. Irritability and anger. C. Mania and impulsivity. D. Increased energy and sociability. Answer. B. Irritability and anger. Rationale. In children and adolescents, depression often manifests as irritability and anger rather than sadness or crying. This is important to recognize in younger populations to distinguish depression from typical mood changes or behavior issues. 54. Which of the following is the primary neurotransmitter implicated in the pathophysiology of depression? A. Dopamine. B. Serotonin. C. Acetylcholine. D. GABA. Answer. B. Serotonin. Rationale. While dopamine and other neurotransmitters play a role, serotonin is the most commonly implicated neurotransmitter in the pathophysiology of depression. This is why many antidepressants target serotonin pathways, such as SSRIs. 55. A patient with depression has been prescribed a monoamine oxidase inhibitor, MALI. Which of the following foods should the patient avoid? A. Fresh fruit. B. Cheese and aged meats. C. Green leafy vegetables. D. Whole grains. Answer. B. Cheese and aged meats. Rationale. MALIs can interact with tyramine-rich foods like cheese, aged meats, and fermented products to cause a hypertensive crisis. Fresh fruits, vegetables, whole grains, and most other foods are safe to consume with MAOIs. 56. What is the most serious side effect associated with tricyclic antidepressants, TCAs? A. Risk of overdose. B. Sedation. C. Sexual dysfunction. D. Weight gain. Answer: A. Risk of overdose. Rationale: the most serious risk associated with TCAs is the potential for overdose, which can be fatal due to cardiac arrhythmias. Sedation, sexual dysfunction, and weight gain are common side effects, but are not as immediately life-threatening. 57. Which of the following is a characteristic symptom of persistent depressive disorder, dysthymia? A. Severe mood swings. B. Chronically low mood lasting for at least 2 years. C. Episodes of mania. D. Psychosis. Answer: B. Chronically low mood lasting for at least 2 years. Rationale: persistent depressive disorder, or dysthymia, is characterized by a low mood lasting for at least 2 years, with symptoms often less severe than major depression. It does not involve the mood swings or episodes of mania seen in bipolar disorder. 58. A nurse is educating a patient about the potential side effects of selective serotonin reuptake inhibitors, SSRIs. Which of the following should be included? A. Weight loss. B. Increased appetite. C. Sexual dysfunction. D. Increased risk of suicide. Answer: C. Sexual dysfunction. Rationale: sexual dysfunction, including reduced libido and difficulty with orgasm, is a well-known side effect of SSRIs. Weight changes and appetite alterations may occur, but are less common. There is also an increased risk of suicide, particularly in younger individuals, during the first few weeks of treatment. 59. Which of the following is an appropriate nursing intervention for a patient experiencing a depressive episode and expressing suicidal thoughts? A. Encourage the patient to write down their feelings in a journal. B. Provide the patient with an isolated space to reflect. C. Establish a safety plan and closely monitor the patient. D. Offer reassurance that the feeling will pass. Answer: C. Establish a safety plan and closely monitor the patient. Rationale: the priority is ensuring patient safety by establishing a safety plan and monitoring the patient closely for suicidal ideation and behaviors. Writing in a journal and offering reassurance may be helpful, but they are not substitutes for ensuring safety. 60. What is a major difference between major depressive disorder, MDD, and bipolar disorder? A. MDD involves periods of elevated mood, whereas bipolar disorder does not. B. Bipolar disorder involves episodes of mania or hypomania, whereas MDD does not. C. MDD is associated with increased energy, whereas bipolar disorder is not. D. Bipolar disorder is treated exclusively with psychotherapy, whereas MDD requires medication. Answer: B. Bipolar disorder involves episodes of mania or hypomania, whereas MDD does not. Rationale: the primary difference is that bipolar disorder involves episodes of elevated mood, either hypomania or mania, which are absent in MDD. Treatment for both conditions can involve both psychotherapy and medications. 61. Which of the following is an important consideration when discontinuing an SSRI? A. Gradual tapering of the medication. B. Switching to an MAOI immediately. C. Increasing the dosage for a week before stopping. D. Discontinuing the medication abruptly. Answer: A. Gradual tapering of the medication. Rationale: SSRIs should be tapered gradually to avoid withdrawal symptoms such as dizziness and irritability. Abrupt discontinuation can lead to these withdrawal symptoms, and increasing the dosage is not recommended. 62. Which of the following is a potential effect of untreated depression on physical health? A. Increased appetite and weight gain. B. Higher risk for cardiovascular disease. C. Improved immune function. D. Enhanced mobility and activity. Answer: B. Higher risk for cardiovascular disease. Rationale: untreated depression has been linked to an increased risk for cardiovascular disease, as the chronic stress and inflammation associated with depression can harm the cardiovascular system. Depression is more likely to lead to reduced appetite, not increased appetite. 63. What is the primary goal of cognitive behavioral therapy, CBT, in treating depression? A. To identify and correct distorted thinking patterns. B. To provide relaxation techniques for stress management. C. To improve interpersonal communication skills. D. To provide a safe and supportive environment. Answer: A. To identify and correct distorted thinking patterns. Rationale: the primary goal of CBT is to help patients identify and challenge negative or distorted thought patterns that contribute to their depressive symptoms. While relaxation techniques and communication skills are important, the focus of CBT is on cognitive restructuring. 64. A patient with bipolar disorder is being treated with a mood stabilizer. What is the primary goal of this treatment? A. To eliminate depressive episodes completely. B. To prevent both manic and depressive episodes. C. To decrease suicidal ideation. D. To treat the symptoms of psychosis. Answer: B. To prevent both manic and depressive episodes. Rationale: mood stabilizers are used in bipolar disorder to prevent both manic and depressive episodes. While they may help reduce suicide risk, the main goal is to prevent the recurrence of mood swings. They do not treat psychosis directly. 65. Which of the following is a common side effect of lithium therapy for bipolar disorder? A. Diarrhea. B. Weight loss. C. Tremors and polyuria. D. Hypotension. Answer: C. Tremors and polyuria. Rationale: lithium can cause side effects such as tremors and polyuria, increased urination, which are well known. Diarrhea, weight loss, and hypotension are not common side effects of lithium. 66. A patient with depression expresses feelings of worthlessness. Which of the following actions should the nurse take? A. Dismiss the patient's feelings as normal. B. Encourage the patient to stop ruminating on negative thoughts. C. Validate the patient's feelings and encourage expression. D. Suggest that the patient try to think positively. Answer: C. Validate the patient's feelings and encourage expression. Rationale: it's important to validate the patient's feelings of worthlessness and encourage them to express their emotions. Dismissing or minimizing their feelings is not helpful, and suggesting that they think positively may be unrealistic and dismissive. 67. Which of the following is an important consideration when prescribing antidepressants to a pregnant woman? A. Only SSRIs are safe during pregnancy. B. The potential risks and benefits must be carefully weighed. C. All antidepressants are contraindicated during pregnancy. D. Antidepressants should be avoided until after delivery. Answer: B. The potential risks and benefits must be carefully weighed. Rationale: the risks and benefits of prescribing antidepressants during pregnancy must be carefully weighed. Some antidepressants are considered safer than others, but all medications have potential risks. Treatment should be tailored to the individual's needs. 68. Which of the following is a common feature of psychotic depression? A. Enhanced mood and energy. B. Delusions and hallucinations. C. Severe irritability and anger. D. Grandiose beliefs about one's abilities. Answer: B. Delusions and hallucinations. Rationale: psychotic depression is characterized by the presence of depressive symptoms along with psychotic features such as delusions or hallucinations. Enhanced mood and grandiosity are seen in mania, not depression. 69. A nurse is working with a patient who is depressed and has a history of suicidal ideation. Which intervention is the priority? A. Encourage the patient to engage in recreational activities. B. Educate the patient about healthy coping mechanisms. C. Establish a no-suicide contract with the patient. D. Ensure the patient's safety and remove potential means of harm. Answer: D. Ensure the patient's safety and remove potential means of harm. Rationale: the priority is ensuring patient safety by removing potential means of harm. While other interventions such as promoting coping mechanisms and discussing suicide prevention are important, safety must come first. 70. Which of the following is a common side effect of antidepressants that affects patient adherence? A. Dry mouth. B. Increased energy. C. Weight loss. D. High blood pressure. Answer: A. Dry mouth. Rationale: Dry mouth is a common side effect of many antidepressants, especially tricyclic antidepressants, TCAs, and serotonin norepinephrine reuptake inhibitors, SNRIs. It can affect patient adherence to treatment due to discomfort. Increased energy, weight loss, and high blood pressure are less common and not typically the main issues with adherence. 71. Which of the following is a characteristic symptom of atypical depression? A. Lack of energy and anhedonia. B. Weight gain and excessive sleep. C. Grandiosity and racing thoughts. D. Severe irritability and agitation. Answer: B. Weight gain and excessive sleep. Rationale: atypical depression is characterized by mood reactivity, improved mood in response to positive events, weight gain, and excessive sleeping, hypersomnia. Anhedonia and lack of energy are typical of major depressive disorder, and grandiosity and racing thoughts are more characteristic of mania. 72. What is a possible side effect of electroconvulsive therapy, ECT, that should be monitored? A. Hearing loss. B. Memory loss. C. Seizures. D. Vision impairment. Answer: B. Memory loss. Rationale: memory loss, especially short-term memory loss, is a known side effect of ECT. While ECT can be effective for treatment-resistant depression, it can affect memory, particularly during and immediately after the procedure. Hearing loss, seizures, and vision impairment are not typical side effects of ECT. 73. Which of the following antidepressants is considered safest for use in pregnant women? A. Monoamine oxidase inhibitors, MAOIs. B. Serotonin norepinephrine reuptake inhibitors, SNRIs. C. Tricyclic antidepressants, TCAs. D. Selective serotonin reuptake inhibitors, SSRIs. Answer: D. Selective serotonin reuptake inhibitors, SSRIs. Rationale: SSRIs are generally considered safer than other antidepressants during pregnancy, although they still carry some risks. MAOIs and TCAs have more known risks, and while SNRIs may be used, they are typically prescribed with caution in pregnancy. 74. Which of the following is a hallmark feature of bipolar disorder? A. Persistent low mood. B. Episodes of both depression and mania. C. Chronic feelings of worthlessness. D. Fear of rejection and social isolation. Answer: B. Episodes of both depression and mania. Rationale: bipolar disorder is characterized by alternating episodes of depression and mania, or hypomania, which distinguishes it from unipolar depression. Persistent low mood and feelings of worthlessness are more typical of depression, while fear of rejection is more associated with social anxiety. 75. What is the primary goal of antidepressant therapy for patients with major depressive disorder, MDD? A. To cure depression permanently. B. To alleviate symptoms and improve quality of life. C. To prevent all future depressive episodes. D. To minimize side effects. Answer: B. To alleviate symptoms and improve quality of life. Rationale: the primary goal of antidepressant therapy is to alleviate symptoms and improve the patient's quality of life, not to cure depression permanently. Prevention of future episodes and minimizing side effects are also important, but symptom relief and functional improvement are the main objectives. 76. Which of the following is an appropriate initial intervention for a patient experiencing a first episode of depression? A. Refer the patient for electroconvulsive therapy, ECT. B. Initiate antidepressant therapy and offer psychotherapy. C. Recommend a long-term psychiatric hospitalization. D. Encourage the patient to wait and see if the symptoms resolve. Answer: B. Initiate antidepressant therapy and offer psychotherapy. Rationale: the initial treatment for first episode depression typically involves antidepressant therapy and psychotherapy, such as cognitive behavioral therapy, CBT. ECT is usually reserved for treatment-resistant depression, and hospitalization is not necessary for most first-time episodes. Waiting is not recommended as depression can worsen without treatment. 77. Which of the following is a characteristic feature of seasonal affective disorder, SAD? A. Symptoms worsen in the summer months. B. Symptoms begin and end during specific seasons, usually winter. C. Persistent, year-round depressive episodes. D. Frequent, short episodes of hypomania. Answer: B. Symptoms begin and end during specific seasons, usually winter. Rationale: seasonal affective disorder is characterized by depressive episodes that occur during specific seasons, typically in the winter months, when there is less sunlight. Symptoms tend to improve during spring or summer. 78. What is the most important nursing intervention for a patient starting a new antidepressant medication? A. Educate the patient about potential side effects and what to expect. B. Increase the dose of the medication immediately for effectiveness. C. Advise the patient to stop the medication if side effects occur. D. Monitor the patient closely for suicidal thoughts and behaviors. Answer: D. Monitor the patient closely for suicidal thoughts and behaviors. Rationale: monitoring for suicidal thoughts and behaviors is essential, especially during the early stages of treatment. It is important to educate the patient about side effects, but the primary concern is the increased risk of suicidality, particularly in younger patients. 79. A patient with depression reports feeling hopeless and says, "I don't see a point in going on." What is the nurse's most appropriate response? A. You should try to think more positively. B. I can see you're feeling really overwhelmed right now. C. You're just being overly dramatic. Things will get better. D. Don't worry. Everyone feels like this sometimes. Answer: B. I can see you're feeling really overwhelmed right now. Rationale: the nurse should validate the patient's feelings and acknowledge their emotional state without minimizing or dismissing their experience. Offering reassurance that is too simplistic can be dismissive, while suggesting that feelings of hopelessness are dramatic is not helpful. 80. Which of the following interventions is most helpful for a patient with depression who expresses a lack of motivation to get out of bed? A. Encourage the patient to stay in bed to conserve energy. B. Suggest that the patient force themselves to engage in activities. C. Set small, achievable goals and gradually increase activity. D. Encourage the patient to rest and take naps throughout the day. Answer: C. Set small, achievable goals and gradually increase activity. Rationale: setting small, manageable goals and gradually increasing activity can help build motivation and prevent overwhelming the patient. Simply staying in bed or forcing the patient into activities can worsen feelings of helplessness.